Hey, good evening, ladies. Welcome to Wellness Wednesday. I hope that you guys are all doing well. I hope you've had a great Wednesday. We are just getting in. We just got in from traveling today. While we're waiting for any ladies who want to watch tonight live, jump on. Um, we were traveling back from upstate New York, where we attempted to view the eclipse. I have an interest in these kind of things. My wife does too. We really wanted to be there in the path of totality, and because we were able to do that 7 years ago here in Idaho, and unfortunately, it was just a little too cloudy, and so we were there. It got dark for 3 minutes, and then we felt it get colder, and then it got light again. That was about it. We really couldn't see a whole lot through the cloud cover, but it was so fun to be there, trying to, at least see what the heavens are trying to tell us. Anyway, it was pretty cool. Anyway, we came back today, so I'm happy to be with you all. Like I need to do every time I am, you know, doing an online event like this, I need to say my disclaimer, so I'll just get right to that. Anything that I say tonight during this Wellness Wednesday is just health information, and it is not intended to be health advice. Please do not start taking, stop taking, change the way you're taking any of your medications. And if you feel like you really need to do that, please consult first with your prescribing practitioner so they can help you make those changes, those adjustments. And certainly by attending this Wellness Wednesday tonight does not establish a doctor-patient relationship. Now, I do have some really important information to share because inflammation is at the heart of every symptom, every disease process in the body. And if you attended the master class, uh, I alluded a lot to it. We talked about it being a trigger for the immune system, autoimmunity. But what is this term inflammation? And it gets thrown out quite a lot, right? It seems to be like, I don't know, like a medical buzzword, if you will. Your doctors probably told you, yeah, you have inflammation. If you have joint pain, you've got inflammation. If you have pain anywhere in the body, you've got inflammation. Um, and a lot of you more savvy women who know this stuff, have been dealing with this stuff a long time, know that there are other symptoms that characterize inflammation, especially. But I'm going to propose, like I said, chronic inflammation being a cause of any symptom. Okay, so we'll get into the difference between acute and chronic inflammation. We'll look at what causes inflammation, and so we'll identify ways to test for inflammation and see if we can't get more to the bottom of it. So that's kind of the outline for what we're going to talk about today. Um, so our bodies are designed to heal. I've said that over and over again. You still have the power to heal. I've told you that over and over again. Um, I I think the lighting's probably okay. If the lighting's okay, give me a thumbs up or a yes in the comment section. If you can see okay, I know sometimes you might have to turn up the brightness on your device. I'm just getting a message from my staff that the lighting might not be super great. If the lighting's okay, throw in a yes in the comments. Um, what I could hang on just a second. Nope. I think letting a little light in might be okay. Okay, so we'll keep going. I've heard enough of, or I see enough of your comments that let me know it's probably okay. Thank you so much. All right, so uh, we have the ability to heal, and that is actually because of acute inflammation and the way our body is designed to send cells um, to help us heal from wounds and cuts and to bring nutrients through the circulatory system to the areas of our body that need immediate attention. So that's where acute inflammation comes in. So when cells are damaged or there are infections, these, the cells send little messengers to um, the the immune system centers, often our lymphatics, our bone marrow, and then those immune system centers release more white blood cells, and um, our liver starts sending more, platelets, or there's platelets that come into to play there to stop the bleeding, to begin the repair process, fibrinogen, that whole, there's several cascades of things that are put into action. I mean, it's an amazing, miraculous thing, ladies, that happens when we are injured, or when we are um, traumatized by whatever it is, uh, to send the right cells and nutrients through the bloodstream to our aid. All right. And so, yeah, we all know very well that our bodies can heal when we are injured. Okay, so that's acute inflammation, and there are different stages of that, and I'm not going to get into the different stages. That gets way too boring and biochemical. Some symptoms or signs that you may have because of inflammation would be certainly pain and swelling, redness. There's certainly a later manifestation would be bruising. Um, this is just all, like I said, part of the healing process. Okay, so acute versus chronic. That is acute. Now, chronic inflammation can be at the tissue level as well. You can have where the body has to work harder because you simply are not in let's say, an ideal, thinking about the economy of the body, okay, where you have the resources that you have. You have only so many resources to go around. Um, so the economy of the body would suggest how well you are going to heal. And so some of you find yourselves in a position where your economy is not great. Maybe you've been dealing with this longer. And so the older you are and the longer you've been dealing with this, sometimes we would think, well, that makes sense. It's going to take longer to heal. And it just depends. Depending on the disease processes that are stressing your body out, make this a little more variable, right? So the more diseases that have been identified uh, might would cause a slower healing process. And and so for those of you who um, really, and I hope that you all believe that. Sorry, I'm going to take some more water. I really hope that you all believe that you still have the power to heal. Goodness gracious. And that your body is equipped to do this for you. Yes, it is. Just understand that for this reason, for the reasons I just mentioned, the available resources that you have, the time that you've spent dealing with these things, all play a role in how um, I assess people and with their potential ability to heal from whatever is going on. Um, and so I just want you to keep that in mind. But there are there are other factors, right? And if we can give you the right nutrients and provide the right you know building blocks and the right help you with the right signals, right? Then this chronic inflammation can can go a little better. Okay, so uh, chronic inflammation would be characterized also by, and I kind of went off on a little tangent there of what to, how your body might be dealing with the chronic inflammation, but chronic inflammation would be characterized by more um, persistent cellular damage. All right, persistent cellular stress, persistent, like we call it there's a cell danger response that is at various stages. And so we have to um, we have to be aware that there's a big difference between acute and chronic inflammation. And then these little messengers become that come about because of chronic inflammation, uh, these are all lumped together with in this, they're called cytokines. Okay. And there are many of these little messengers, and they have a hormetic effect, like a hormone like effect on how they help your cells, or not help your cells. Some of these cause your cells to be more susceptible to damage. And so some of these are made by the toxins and the infectious cells or agents like the bacteria themselves. Some of them are created by viruses when the viruses take over your cellular DNA and protein making machinery, and so they're making these little messengers, and they're going to cause more cellular damage. That's how they do their dirty work and cause this inflammation. So um, this this is more characteristic of chronic inflammation associated with more chronic infections, chronic viruses, parasites. So I'm getting into some of the causes of this of inflammation, but just to kind of give you a little sneak preview there. So chronic inflammation is also characterized by cellular membrane damage, where you've probably heard of oxidative stress. You may have heard of it, maybe not. Um, and oxidative stress will cause your cellular membranes uh, to be less functional. They're keeping your cells kind of compartmentalized, these membranes, and help decide what you take into the cells and what the cells release in terms of toxins. And if we think of a cell having like, I don't know, maybe it's more like a balloon. You think of a cell like a balloon, and the membrane is the balloon part, right? The rubbery part of the balloon. Well, imagine that it can let things in and out, okay? But it keeps its shape. Well, and its volume, it keeps its shape and volume. When the cell membrane is damaged by oxidative stress, have you ever used a balloon to make like a paper mache, you know, thing? And so you wrap it in the news, the wet, the the newspapers, dripped in, um, whatever it is. I can't remember, like flour and water. I guess I think I used to make when I was a kid. I remember doing that, something like that. Um, and then that hardens. Okay, so oxidative stress is caused by uh, reactive oxygen species known as free radicals. And free radicals are created when you uh, have to metabolize something. Okay, your cells use the oxygen and then spit out the oxygen molecule that, I mean, it uses the electric energy from that, and then it spits out the oxygen with one electron that is now a reactive oxygen species, and it can cause damage to these membranes. They have to, those reactive oxygen species or free radicals have to be neutralized by, do you guys remember the term? Antioxidants, right? So the think about it like this. You use up oxygen, it becomes a little renegade at that point, and you have to have something come in and neutralize it and cause it to be less of a, I don't know, less rebellious. It's like the kid at school that acts out, and you have to have a teacher come in and take him by the arm down to the principal's office. Well, um, think about it like that. It's just, these can be damaging to the cell membrane, these reactive oxygen molecules. Okay, I don't know if I can make it any more elementary than that. They're just they have the potential to damage the membranes, and they do. And so you have a mechanism in your body, in every tissue. Every tissue has these antioxidants. The liver especially is, where you have a lot of these antioxidants that are going to help neutralize these free radicals. Okay, so then they won't do as much damage. So the problem is, like I said, when we have to metabolize so much, like eating the wrong foods will cause more free radicals. Eating more carbs will cause more free radicals. Sugars cause us to create more free radicals. Um, and preservatives and things that we can't digest, where we just can't do much about, and then our liver has to take care of these, and this process creates more free radicals. All right. And more than we can handle, and that's why these end up causing more degeneration and more inflammation, chronic inflammation of these cell membranes that now are becoming kind of more hardened, like that, like I was talking about, that paper mache kind of an idea. Some of your cells, they're just not working very well, and then they become sicker and sicker, and they just don't do their job. So when you think about the causes of this inflammation, and we have to, in order to help reverse it and help these cells heal, and they can heal if we give them the right nutrients and so forth. But we've also got to take away what's causing the inflammation in the first place. So you have to take away the toxins. And so many of us are genetically susceptible um, to biotoxins. I went over that in the master class. And so we have to see if we're uh, how we deal with those toxins like mold and Lyme and parasite toxins, parasites themselves. Okay. Um, Infections, bacteria, viruses, yeasts are other types of parasites that we have to that they produce toxins. We've got to minimize those. So we've got to find those and treat those types of infections. Then there's foods, like I said, too many of the wrong foods. And we talked about 5 inflammatory foods in the master class. We talked about uh, wheat and gluten and grains, right? Wheat and other grains. We talked about dairy. We talked about soy protein, especially the soy protein. We talked about sugars and fructose. We talked about um, corn being a grain, but a lot of people think it's a vegetable. So those 5 foods um, is are very uh, big causes, huge causes of this inflammation. Certainly chemicals, so pesticides and herbicides and fertilizers and just all kinds of things that get into our food supply. Heavy metals, certainly from our environment, from our, silver fillings, from vaccines, from lots of different sources. A lot of us, maybe work in where there's, areas where you're prone to heavy metal toxicity. Um, Trauma, physical traumas, all right, cellular damage. That, of course, when you have had maybe repeated trauma or you're um, yeah, some of you may not like this, but collegiate athletes, competitive athletes, constantly traumatizing your body physically. I mean, you don't think of it that way. You think about, well, I love the endorphins that come from, all that exercise, but that's that you can have too much of a good thing. And I have never met a healthy athlete. I have never met a healthy athlete. They almost always end up coming to me with a chronic disease or autoimmunity. I mean, I'm not trying to put any of that down. I'm just telling you what I have seen in my practice over and over and over again. Um, so physical trauma and that stress that's caused from that. Certainly emotional trauma will cause inflammation, ladies. Emotional and mental trauma will cause inflammation. VOCs, volatile organic compounds, again, in our air and the pollution that we breathe in. So these environmental type toxins are capable of causing a lot of inflammation. And then electromagnetic and magnetic fields, EMFs, would round out the list. And I think to a certain degree, um, there's still a lot of misinformation out there about these, but it's great to ground ourselves. It's great to um, to really kind of minimize, turn off your Wi-Fi at night, put your phone on airplane mode if you're going to have it right on your bedside, or better yet, keep your phone in the bathroom away from your bed. I even sleep with a grounding mat and pillow cover, which I believe really makes a difference. There are a lot of things that are in our environment that we just need to be aware of. In our water, and I mentioned a lot of these chemicals come from the water. In previous Wellness Wednesdays, we talked about halogens and so forth. So these are many causes of chronic inflammation. And so the quicker we can get rid of those, the key to understanding what we have going on really, again, comes in the form of comprehensive testing. And the blueprint that I shared in the masterclass, it's vital to follow the blueprint. And um, and I'll be doing another masterclass to really explain how that works. In the summer sometime. We'll be announcing those dates when we have those available. It's it's really important that we do the right testing to be able to find these root causes, to figure out what's causing your fatigue. Why can't you lose weight? And it's what's causing the insulin resistance that's leading to most of you ladies who have weight gain issues. It's most often due to insulin resistance. So, well, guess what? That's caused by inflammation. That insulin resistance, where the cells can't use oxygen, or excuse me, insulin properly, well, or oxygen, it's because of the membrane damage and the inability of your cells to express or put the right receptors on the membranes. If this is the membrane surface, you've got these receptors ready to take I keep saying oxygen, get the insulin in order to pull the glucose into the cell. Okay, that's its job. It's the key to get glucose as fuel into the cell so that your cell can use it and burn it as fuel to metabolize and do what it needs to do. Well, this is caused by inflammation, where your cells can't even put the receptor out there for it. Okay, this is the key to unlocking your ill health. Honestly, it's understanding the root causes of this cellular inflammation and dysfunction. So I work with my patients to on a cellular healing level. All right, we've got to, like I said, get the right test to find out what's causing this inflammation, and work hard to get rid of it, making the right changes, and it works. So, all right, I thought I saw a few questions pop up. Let me go to the comments. Sorry, it takes me a minute to go through. Okay, cellular detox. Yeah, I mean that is part of the process. Absolutely part of the process. One question is, where do you find swelling? So it could be global. It could be widespread. So your feet and ankles, your lower extremities, could be your joints, could be small joints, feet, hands. You could just notice you're puffy. You could notice swelling under your eyes and your just puffiness, right? It could be yeah, just more than you were used to seeing in the past, probably. Um, so joint swelling is a real common place to see that. All right, let's see. The question is, could exercise worsen chronic inflammation? And yes, it absolutely can worsen that. So the wrong exercise certainly can worsen inflammation. It can be a physical stress. If you don't have enough energy as well to exercise, you better believe that trying to exercise more than you have energy to do could actually be counterproductive and could be the one cause of chronic inflammation. Yeah, and again, once again, swelling doesn't just happen after an injury. You can notice this on a chronic basis. So again, just briefly to explain the difference between chronic and acute inflammation. Acute inflammation happens after an injury to help your body heal. So a cut or a bruise, blunt force trauma, or like a fall or something, a fracture of a bone. Your body goes to work right away to heal that, and that's acute inflammation that you need to be able to uh, to have. Um, so chronic is this cellular membrane damage that stays, that hangs around, that happens because of free radical damage, not necessarily because of trauma or but repeated trauma certainly can cause an chronic inflammation. And then there was a question about is a sauna helpful, or is it a stressor? Um, It really depends, but most of the time, if you're in the place where you really need to detox, um, sauna treatment can be very helpful. But again, it's very individualized. If you are depleted of nutrients, sauna therapy may not be helpful, and it may be more harmful. Icing the swelling after an injury a bad thing? If swelling is helping. Well, in we've learned that sometimes your body responds too well, and the swelling can be too much, and so um, there's a lot more tissue damage than you need to be going through. So icing can help in the acute setting. It's not necessarily going to prevent healing. But many people have the idea that you just have to keep the ice on it. 10 to 15 minutes of icing at a time, separated by, I would say, at least 30, 45 minutes. So ice for just a short period of time is and then intermittently doing that. It's never a good idea to just keep ice on an injured area for hours on end. So, question is arthritis due to chronic inflammation? Yes, most of the time arthritis is due to chronic inflammation, and uh, and that would be the cause of the swelling and the pain. Do we have any more questions? Good questions, ladies. I think we've covered them all. You guys are great. I love the questions you ask, and again, my goal is to be able to teach you the truth about your body. There are answers out there. There's hope. Have hope, for goodness sake, and keep on coming around for these Wellness Wednesdays. Oops, another question snuck in. Is arthritis reversible then? Absolutely. Yes, it is. Seen it happen countless times. Countless times. Lots of ladies even have shared their testimonials in the group. So watch for those, and have hope. Like I said, and thanks for joining me, and we'll see you soon. All right. Have a good night, everyone.